You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Welcome to Dr. Osborne's Zone. Today, we're talking all about the very important mineral zinc. Now, zinc has, as you can see here, more than 200 functions, actually much more than that. It's enzymatically, we now know of 300 enzymes that zinc plays a role in running. We also know it plays a role in more than 1,000 functions as it relates to protein folding and protein regulation. So many functions, so much more than what we actually could ever really talk about. We could write libraries about zinc's function. But I want to give you a very good overview of some of these functions. So more than 300 enzymatic activities, regulates immune strength and function. It's important for healing and repair. It's necessary for structured formation of hundreds of molecules. That's what we're talking about here. We need it for DNA synthesis. We need it for growth and development of tissue in skin, muscles, joints, and others. We also need it for sperm health. And it's required to run our antioxidant systems to protect our DNA from premature damage. Now let's dive in a little bit deeper to some of these things. Let's talk first about the discovery of zinc as an essential nutrient. This is relatively a new discovery. We've only known about its essentiality since 1963. So we've got a pretty short record of time as zinc as an essential nutrient. Now you can see the major factor contributing to zinc deficiency, I think this is super important, is a high phytate containing cereal protein intake in the developing world, and nearly 2 billion subjects may be zinc deficient. So, 2 billion people potentially zinc deficient, and cereal and high phytate foods, so like legumes, bind zinc and reduce its absorption. And this is one of the reasons why no grain, no pain. Because high grain diets can deplete your ability to absorb zinc and lead to zinc deficiencies. And after we're done talking about zinc today, that's going to make you super concerned. Now, you see major clinical problems resulting from zinc deficiency in humans: growth retardation, cell-mediated immune dysfunction, cognitive impairments. We also know greater than 300 enzymes and 1,000 transcription factors require zinc for their activities. Zinc has been very successfully used, and this is in human studies, by the way, as therapeutic modality for the management of acute diarrhea in children, for the copper deposition disease, Wilson's disease, as well as the common cold, and for the prevention of blindness in patients with age-related dry macular degeneration. It's also very effective in decreasing the incidence of infection in the elderly, and that's just warming up. We're just getting started. We're going to talk about so much more, but I think it's just important that you understand the mass spectrum of how zinc functions and can influence human health and disease. So you see here in this review, zinc status associated with inflammation, oxidative stress. And we know inflammation is a primary driver of pretty much every known degenerative disease, as oxidative stress causes or is a cause of inflammation. We also know that zinc status associated with lipids and glucose metabolism. But what I'm showing you here in this diagram is just simply a drawing that helps you understand a little bit better. I've kind of highlighted some things for you, but you can see here SOD. SOD stands for superoxide dismutase. This is a very specialized enzyme that helps prevent the production of free radicals and free radical damage. So think of it as it's an antioxidant. Now, zinc also regulates something called NRF2. And NRF2 is responsible for helping our body generate glutathione. Now, if you've ever heard of glutathione before, glutathione is sometimes referred to as the master antioxidant. And of course, zinc plays a role in stimulating and preserving the function of glutathione. We also know that zinc plays a role in something called metallothionein synthesis. Now, this particular molecule helps to reduce damage from things like toxic metals. And so if you've been exposed to cadmium, arsenic, or lead, or mercury, etc., zinc runs this system that helps to reduce the damage from those potential metal toxicities. We also know that decreased production of pro-inflammatory cytokines, enzymes, and adhesion molecules, resulting in the prevention of inflammatory response. So if you look down here, zinc inhibits these transcription factors that lead to the expression of inflammatory pathways. That's what all these are referring to. So cytokines, enzyme activation. COX-2, by the way, many of you may not have heard of this, but let's make sense of it. COX-2 is when a doctor gives the drug Celebrex to stop inflammation or to block inflammation or to block pain. Now, these drugs are actually, that's what they're doing. They're blocking that. Well, look, zinc does that naturally. And how many people are zinc deficient? Depending on the research study, it's estimated anywhere between 20 and 40% of people are zinc deficient. So how many people struggle with chronic pain and take Celebrex or drugs like Celebrex, the drugs that are called non-steroidal anti-inflammatories, NSAIDs, if you will. So again, Celebrex, COX-2, zinc actually has an effect on COX-2 as well. And then we have things like adhesion molecules where these play a role is in inflammation of blood vessels. So if you've ever been told that you have a vascular inflammatory problem like atherosclerosis, arteriosclerosis, you know, these adhesion molecules play a role in the development of those cardiovascular diseases. And again, zinc plays a regulatory role in helping with that. We also have cytokine expression. So cytokines are chemicals produced by white blood cells that drive inflammation, things like TNF-alpha, interleukin. These chemicals are oftentimes in rheumatology are measured. They're actually measured as a reflection or as a tool for doctors to monitor the levels of inflammation that are occurring in an individual. So again, zinc plays a role in all three of these different situations. Very important functions. Now, moving over here, you can see some of the other general functions of zinc. You see here the extensive evidence demonstrating the prevalence of zinc deficiency in a wide range of cancer types suggests that zinc deficiency should be considered a relatively widespread feature of multiple cancers. While research regarding the potential clinical utility of testing zinc levels in patients with or at risk of developing cancer is still preliminary, the data suggests that zinc deficiency may be a potential biomarker for identifying patients at risk for developing cancer. That's a pretty bold statement. And we look at some of the functions of zinc here in the center as Zn is zinc, as a mechanism or multiple mechanisms in cancer regulation. You see one of these is in the immunity, the maturation of immune cells. And so you have immune cells which are what help us to fight cancer, to beat cancer. Zinc also functions in this process called apoptosis. Apoptosis is just a fancy way of saying programmed cell death. So your cells have mechanisms within them so that when there's a mutation of a cell, the cell knows to commit suicide because mutations of cells are what lead to cancer. And apoptosis is a form of programmed cell suicide to stop damaged cells from making daughter cells that would potentially lead to mutations that could cause cancer. A lot of people talk about this term apoptosis as it relates to fasting. You hear a lot of the people in the fasting community talk about how longer term fasting helps to improve apoptosis. Well, you need zinc for this process. We know that zinc is required for different protein folding, and so many of these proteins have regulatory activity as it relates to cancer. And as I mentioned earlier, zinc plays a role in this chemical here, SOD, superoxide dismutase, which is a very potent antioxidant that helps regulate the potential for damage to the DNA. Again, that's a side effect. Damage to the DNA potentially leads to point mutations or mutations within the cells that can contribute to different forms of cancer. So zinc, we don't want to underemphasize just how important it is. Okay, so let's talk about some of just the general symptoms. I'm going to go through a lot of these. Some of these are kind of early things you can pick up on. Some of these are more serious. But this first one here, we saw this a lot in the last several years, loss of taste and smell, because this is very common when people get viral infections. Why? Because part of the role of zinc is it plays a role in viral replication inhibition. So it stops viruses from replicating and making new DNA or RNA materials and slows down the capacity for them to create infection. So when you're sick with viral infection, you're burning through zinc to try to neutralize that virus. But one of the functions of zinc is in the olfactory nerves, so your nerves of smell, basically. And so you lose your capacity at smell, and when you lose smell, you also lose taste. The two are intrinsically related, and zinc deficiency can cause this, but a viral infection can cause a zinc deficiency. And again, this is why so many people lost their taste or their smell during the pandemic. And if you recall, a lot of people were making the recommendation to use quercetin plus zinc. Why the combination? Why not just zinc? Because quercetin is, if this is a cell and we've got zinc floating outside the cell and we're trying to get zinc into the cell, quercetin helps to push that through. It acts as what's called an ionophore. So it opens up channels within the cell that allows zinc to get into the cell. So the combination of the two can be synergistic together. We also know that zinc can cause white spots on the nail beds, on the fingernails. It can cause hair loss, poor immune function, skin inflammation. Skin rash is a very common symptom of zinc deficiency. We know it can disrupt your ability to sleep, so trouble sleeping. Fertility problems in men. So often, I see this very frequently, that you have a couple, they're trying to have a baby, and so they want to know what they can do nutritionally to kind of help support that. And most of the focus in infertility clinics is generally on the woman, right? They're trying to adjust or alter the hormones in the woman to improve the fertility. But a lot of times what we'll see is it's not the woman, it's actually the men. And so low levels of zinc can reduce sperm quality and quantity. So it's going to affect the sperm itself. And there's some research now showing that also motility is affected. So that's the ability for the sperm to swim, to make the journey, to fertilize the egg. So fertility problems in men. And we get women, can get irregular periods. So, regular periods contribute also to infertility problems. We get low blood cell counts. So zinc is important in red blood cell formation. It's also important in white blood cell formation. So low counts can be a consequence of zinc deficiency. In men, we see low testosterone. And we also see radical blood sugar abnormalities. And so zinc plays a role not only in the production of insulin, but in the storage of insulin and in how well insulin works on your cells. So major roles that zinc plays as it relates to regulating blood sugar. So let's look at some of these things. There's a form of genetic zinc deficiency typically identified in infants. And it's called acrodermatitis enteropathica. And you can see I've got an image here. The study credit goes to Dr. Albert Yen, but you can see the rash on the face here, and it's in a U shape. And the top of the lip is spared. There's not any rash over the top of the lip. This is very typical of a zinc deficiency in infants. Now, you don't have to have the genetic disorder. I've seen this in babies that didn't have acrodermatitis and teropathica, in essence, a genetic defect. But we sometimes will see, especially babies that are predominantly fed cereal-based diets, so all the cereal that parents are feeding infants. As we said before, one of the top causes of zinc deficiency is the phytate content of cereals that reduce the ability to absorb the zinc. So you can get, in infants and babies, you can get this type of rash presentation that oftentimes is called an infection. Sometimes it's called eczema, and so doctors a lot of times will write either an antibiotic or they'll write a steroid prescription, a steroid cream prescription, when in fact this could be a zinc deficiency. Now, in addition to the rash on the face, you can see that rash as a diaper rash, and it's also important if you're a parent with a child that has a chronic diaper rash and you don't know why and nothing's really resolving it, you might suspect zinc deficiency in these particular cases. So, you see, pregnant women and children are at greatest risk of zinc deficiency. Acquired zinc deficiency can be seen in anorexia nervosa as well. So if you've got a history of that mental disorder around food, definitely you're at greater risk. Alcoholism, alcohol can deplete zinc. Inflammatory bowel disease because of the absorption problems, and celiac or gluten-related illnesses, chronic diarrhea. Gastric bypass. How many of you have had a gastric bypass surgery and your surgeon before the surgery said, after this, you're going to need to consider having your nutritional values measured on a regular basis because of the risk of malnutrition as a result of the surgery? So zinc, one of those nutrient risks. And then certain medications can also deplete zinc, and we'll get into that shortly. Stay with me. You see, dermatitis, characterized by sharply demarcated erythematous and eczematous plaques that become vesicular, bullous, pustular, erosive, U-shaped, which is what I was showing you earlier, a U-shaped appearance here, right? And then you get chronic diaper rash in infants with accompanied diarrhea. So if your baby's having diarrhea, diaper rash, facial rashes, and the doctor's prescribing antibiotics and prescribing topical steroid creams, ask the doctor to run a zinc test on the baby. Zinc levels are easy to measure. Now, most commonly what's available is zinc in the serum. And this is, insurance covers this type of test, and 60 to 120 is generally the range on most labs, is somewhere in that neighborhood averages. What you're going to see in babies with this type of stuff is you're going to see levels in the 40-50 range. That would be a clue-in or a cue-in to suspect that supplementation with zinc might be very helpful in these situations. We also see that superinfection with bacteria like Staph aureus and Candida yeast is common due to immune dysregulation, meaning in these types of situations of infantile zinc deficiency, these babies become susceptible to staph infection, which can affect the skin. So you can have an infection, but you can also have a zinc deficiency. So keep in mind that zinc deficiency depletes the immune system's ability to fight the infection, but it also causes a skin dysregulation. So you can initially have a zinc deficiency that causes a skin dysregulation, but because of its effect on the immune system, allows for an infection to also form, and now you've got two problems. And this is partly why you want to know this information, because if this is going on, you've got to rule these things out too, but you want to rule out the zinc deficiency. And most doctors, because they're not trained in nutrition, aren't even looking at this stuff. We also know that zinc deficiency causes impaired wound healing. So if you've had a surgery and you're not healing and you're not repairing, consider zinc as a potential reason why. We know in kids it can cause growth retardation and hypogonadism in male patients. We know paronychia, which is an inflammation on the nail beds, may also be commonly seen. I'll show you a picture of that. Zinc deficiency can present as psoriasis-form dermatitis on the hands and the feet and the knees. So if you've got a diagnosis of psoriasis and your doctor hasn't checked your zinc levels, shame on your doctor. Ask him to measure it. Okay, so let's show you some pictures. So I showed you the rash on the face, but let's look at some fingernails and show you some pictures of what paronychia looks like. So there's two kind of findings that we see with zinc deficiency, and these are typically earlier onset findings, but you can see here in this image around the base of the nail, you see all this rough inflammatory looking skin. That's called paronychia. And it's a common finding in zinc deficiency. You'll also find, though, you see at the tip of this nail bed, you see that white spot on the nail bed. We may move that back out of the way. It's just a slight white spot here. You can see one here as well. You can see one right here at the tip. These little tiny white spots, you see one here, you see one here, those are called leukonychia. And they're also a hallmark of zinc deficiency. Now, these white spots can also be calcium deficit and selenium deficit, so it's not just specific to zinc, but there are a number of older literature and older studies where patients with these types of findings, once supplemented with zinc, had resolution of these findings. And so it's important for you to understand that if you see those a lot on your nail beds, you might consider, again, asking your doctor to measure your zinc levels as a standard of trying to figure out what's going on. You can see here, this study, natural treatment option for nail disorders, as published in Dermatology. Treatment of chronichia aims to stop the source of irritation. Common irritants include soaps and detergents, so that's a possibility as well. For patients with zinc deficiency, which is a known cause of chronic paronychia, supplementary treatment of 20 milligrams of zinc per day may help. So, again, if you haven't considered zinc supplementation, 20 milligrams a day is a really safe dose to take. You can buy it over the counter. Super easy to do. Okay, let's talk about some more symptoms related to zinc deficiency. As you see here, I've kind of broken it down based on this study. This was a really great review done by Ananda Prasad, published in Advances in Nutrition. But you can see mild deficiency of zinc. As a result of mild deficiency, we observed a decreased serum testosterone level. So guys, if your testosterone's low and your doctor's wanting to put a pellet under your skin or wanting to inject you once a month, ask them to measure your zinc levels. We see decreased natural killer cell lytic activity. So the natural killer cells in the immune system don't do their work as well. We see decreased interleukin-2 activity of T helper cells. So again, reduced function of immune system activity. Hyperammonemia, hypogeusia, which is, again, hypogeusia is a loss of taste. Decreased dark adaptation. One of the things that zinc does, zinc produces or helps your body produce something called RBP. That's retinol binding protein. And retinol binding protein, what is retinol? Retinol is vitamin A. So if you want to look at this from the perspective of zinc produces a protein that carries vitamin A. Vitamin A has to get to your eyes from your gut to your eyes. That requires a carrier protein. That carrier protein is retinol binding protein. If you don't have enough zinc, you can't make RBP. When you don't have it, then your eyes develop vitamin A deficiency. This is going to affect your dark adaptation, your ability to see at night well. So if those of you who find that you have to have a lot of light on to be able to see, you might think about zinc and or vitamin A as being contributory to that, because zinc deficiency can cause a vitamin A deficiency. We also see decreased lean body mass. So if you're losing muscle and you don't know why, remember that what we said up here with this testosterone, it's not just men, it's women too. You need testosterone to maintain good muscle mass. This study clearly established that even a mild deficiency of zinc in humans affect clinical, biochemical, and immunological functions adversely. So you don't have to have a frank, overt zinc disease to have milder symptoms starting to show up early on. And if the doctor's trained in nutrition, they can measure these things. They can pick up on this. Now you can see down here, moderate deficiency of zinc. We get growth in children, growth retardation. So if you've got a child that's not growing, you might ask your pediatrician to measure zinc levels. Male hypogonadism in adolescence, rough skin, poor appetite, mental lethargy, delayed wound healing, we talked about that, cell-mediated immune dysfunctions, and abnormal neurosensory changes. It's now apparent that a nutritional deficiency of zinc in humans is fairly prevalent throughout the world, particularly in areas where cereal, we keep coming up with this, right? Cereal proteins are primary in local diets. What do we have? What do we got in our kids today? The second they are born, and you're in the hospital, you're getting all these free boxes from these companies with, you know, wheat and barley and rye and oat-based cereal products to start feeding them. How many parents, you see infants walking around and they got little baggies and the baggies are full of Cheerios. It's like the primary staple that we've put our children on is the cereal protein nonsense, and it drives down zinc absorption, increases the risk for zinc deficiency. You can see here, this study, Kavdar et al., observed a decreased zinc level in almost 30% of low socioeconomic status pregnant women. This was in Turkey, this study. Their diet consisted of mainly cereals. Maternal zinc deficiency was associated with severe congenital malformation of the central nervous system in the fetuses and maternal morbidity, so increased risk of death and increased risk of severe nerve damage in babies being born. So frequently I hear doctors say, oh, that doesn't exist here. Zinc deficiency, nutrition deficiency doesn't exist in modern countries like the US. And it's like 60 to 70% of the total caloric intake of the United States is grain. Think again, buddy. You're wrong. You're just not measuring it. It's easy to say it doesn't exist when you're not measuring it. But when you start measuring it and you see it as a standard of what you find on a regular basis, you know, there's a lot of health problems that can be solved and resolved. You see here, the discovery that zinc is essential for humans made a notable impact. 1974, Food and Nutrition Board of the U.S. National Academy of Sciences made a landmark decision to declare zinc an essential nutrient and establish recommended dietary allowances for humans. Meta-analysis of 33 intervention trials of zinc supplementation and its effects on children's growth in many countries showed that zinc supplementation alone had a statistically significant effect on linear growth, so that's growing upwards, but also on body weight gain. This has to do with zinc's role in muscle formation and in bone formation. Zinc supplementation has been shown to improve neuropsychological functions. In Chinese children with zinc deficiency, it reduces the incidence and duration of acute and chronic diarrhea, acute lower respiratory tract infections in children. So think about that. How many of you take your kids to the doctor every year because of an upper respiratory infection, a cold or a flu, and the doctor's pumping full of meds? How many of you get a zinc lozenge for your kids? I mean, there have been studies that show that zinc, you know, anywhere from 25 to 75 milligrams in a lozenge, and this is per day, especially if you give it at the immediate onset of symptoms of a cold or a flu, have dramatic impact on not only whether or not that child goes on to get sick, but the duration of the illness. So it impacts the speed at which a person recovers. It also impacts the actual immune system's ability to recover more effectively. Zinc deficiency has now been recognized to be associated with many diseases: malabsorption syndrome, chronic liver disease, chronic renal disease, sickle cell disease. There's research showing that people with sickle cell, when they take zinc, it improves their red blood cell function and reduces the side effects of the sickle cell anemia. We know diabetes, malignancy, as I mentioned earlier, cancers, as well as chronic illnesses. And I showed you all the ways zinc plays a regulatory role in inflammation. This problem has been known, well, at this point, this paper is a few years old, but it's been known for about 60 years, and the solution is still outstanding. And this is true. This paper was published in 2003, so 20 years down, or 21 years later, solution is still outstanding. We haven't done anything new about this problem, and we've known about it for 60 years. Despite all the evidence, practically no attention has been given to the problem of zinc deficiency by the world's organizations. Growth retardation, increased susceptibility to infection, cognitive impairment are common, where nutritional deficiency of zinc is also prevalent. Thus, a correction of zinc deficiency is likely to have a great impact on the health of large populations in the developing world. I would say not even in the developing world, in the developed world as well. It's imperative that the World Health Organization must include the problem in its top priorities. I can remember when we were censored for talking about zinc just a few years ago because of its profound impact on the reduction of the potential for infection. Look, the way I look at it is the world organizations that are revolving around health don't want you to know this stuff, or they'd be talking about it with me. This is not my opinion or opining on the topic. This is 60 years of hard science and research on zinc supplementation in sick people. And so anyway, let's look at causes of zinc deficiency. There's several different ones. Some of them listed here: poor diet. So we talked about cereal. Cereal-rich diet is a poor diet. It's processed, especially the cereals today are so processed. I mean, processed, they have herbicides and pesticides added to them. Most of these sugars, or most of these cereals are super rich as well and have added sugars in them. We know sugar can deplete zinc and alter zinc metabolism. So poor diet, U.S., I would say we have a poor diet. We don't have a great diet here in the States unless you and your family are taking extreme measures, away from the standard grocery store to maintain health. Stress can deplete zinc. A diet high in phytates, as we said here, cereal-rich. Damage to the GI tract. So this could be celiac disease, Crohn's, ulcerative colitis. This could be gastritis or esophagitis, any itis of the gut that would affect the absorption. We've got candida overgrowth. Can cause zinc deficiency. Alcohol, excessive calcium intake. One of the top recommendations, one of the only nutritional recommendations that we see coming from mainstream medicine is in women that have been diagnosed with bone loss through a bone scan, and they tell them what? They say, take calcium. And they tell them to take high levels, but did they ever measure their calcium levels? Typically never. One of the other things, this is a true story, had an OB-GYN one time. We had the same patient, and the OB-GYN told my patient, she said, take Tums with calcium to get her calcium. Now, if you know anything about calcium absorption requires acid. You can't absorb it without stomach acid. Tums neutralizes stomach acid. So taking Tums with calcium is like taking no calcium. And you're neutralizing stomach acid. And when you neutralize stomach acid, you also reduce the ability to absorb zinc and magnesium and vitamin B12 and many other nutrients. So at any rate, and then genetic disease, as I mentioned earlier, showed you a picture of a young child, acrodermatitis enteropathica is one of the genetic disorders associated with zinc metabolism deficiency. Okay. Let's look at some other things. So here's this research paper, a review on inhibitors and enhancers of zinc. See, various dietary factors can influence zinc absorption. We keep coming back to this phytic acid. I'm going to keep saying it. It's the principal dietary factor known to limit zinc bioavailability by strongly binding zinc in the gastrointestinal tract. So in your gut, if your diet is rich in cereal, phytates, or beans, this is legumes as well, you get zinc and you get a phytate, and they bind together, and then it makes it hard for that zinc to be absorbed into the bloodstream. And so you see here, it's the principal dietary factor. Principal meaning top, right? Not a minor factor, but the principal factor. Strongly binding zinc in the GI tract. Not weakly or meekly binding it, but strongly binding it. It's the major, so we know that phytate is the major phosphorus storage component in plant seeds. So if your diet is predominantly vegan, plant seed based, those chemicals, those phytates, are going to bind. And it's not just zinc, it's other minerals as well, but it's going to make it very hard for zinc to be absorbed. So it's very important that you know that, because if you're staying on that kind of diet, no judgment from me, but it's very easy to ask a doctor to run your zinc levels and just make sure you're getting it absorbed properly, because zinc deficiency can create a lot of damaging problems. You see demographic and clinical characteristics of patients with zinc deficiency. This was a study done in Japan. It's a cross-sectional study using a nationwide Japanese claims database, identified several variables associated with zinc deficiency. So still talking about causes of zinc deficiency. So these variables included being an older adult, so being older, being a man or male, being an inpatient in a hospital, having comorbidities, meaning having more than one medical condition, such as respiratory infections, decubitus ulcers, pressure area, sarcopenia. How many elderly people do you know that are not adequately muscled? That's what sarcopenia means. It means age-related muscle loss, as well as chronic kidney disease. So these were the variable factors that all contributed to whether they cause the zinc deficiency or whether zinc deficiency caused these disorders. I think it's a little bit of both. You can also see additionally the use of certain medications, namely spironolactone, furosemide, thyroid hormones. So women, if you're taking thyroid medicines, ladies and gentlemen, if you're taking diuretics for your blood pressure, that's what furosemide is. Systemic antibacterial. So if you're IV antibiotics, maybe you had a surgery or maybe you just got out of the hospital. Corticosteroids. How many of you using anti-inflammatory corticosteroids? Many of you get injections in joints. Many of you are taking them orally. All these are associated with zinc deficiency as drivers, as driving forces behind causation. So if that's you, again, what's the theme? It's real easy to order a test. It's real easy to get the information. Let's look here. Zinc is essential not just for the surgery, but for the periods before and after surgery. You've heard me talk about surgery before. As a matter of fact, I've done entire shows on how to recover from surgery using nutrition. Zinc deficiency is associated with delayed bone healing. So if you've broken a bone, skin fragility, susceptibility to infection due to immunodepression. So if you're going under surgery, you're going to be taking some drugs most likely that are immunosuppressive already. Therefore, it has a significant impact on surgical outcomes. The author first became interested in the mechanism of bone healing in a case where an ankle fracture in a dialysis patient did not heal after 3 operations, and a zinc wave was later found in electron microscopy and electron probe X-ray, microanalysis of frozen sections of the ossified area of the yellow ligament. Subsequently, shoulder injections to a rheumatoid arthritis patient caused pyogenic arthritis, suggesting that low zinc levels in rheumatoid arthritis patients resulted in weak skin and low skin tenderness threshold. Later analysis showed that patients with zinc levels below 50 micrograms per deciliter, remember what I told you earlier, generally speaking, the reference range of normality is 60 to 120 micrograms per deciliter. They're saying that 50 micrograms per deciliter here died early due to infection, suggesting that low zinc levels are also related to poor immunity. 2 groups were compared after 2 months, after 6 months of supplementation with 34 milligrams of daily zinc to examine how much zinc should be supplemented by the time of joint replacement surgery. So if you've had joint replacement, hip replacement, those types, there was no significant difference in zinc levels in the 2 groups at 1 month before surgery, but at 7 days before surgery and 3 days after surgery, in the first group, zinc levels were significantly lower. Skin necrosis occurred in 3 cases, and skin healing was delayed in 4. So this is where it's really important when you're thinking about supplementation with zinc. Maybe you have a pre-scheduled surgery coming up. Hopefully it's pre-scheduled and not an emergency. That's terrible, but at least 1 week before, and I recommend 8 weeks post, as well as during. So if you're in the hospital, take your zinc with you. The problem many people run into with surgery is doctors don't understand nutrition. So the standard protocol when you're going into surgery, doctors will say, discontinue all supplements. In other words, be off of everything before 1 week before surgery, during surgery, and even up to a week after surgery, but it's discontinue all supplements. This is bad advice, by the way. This is actually, in my opinion, it's medical neglect. Any person going into surgery should be having a micronutrient analysis to assess their nutritional status so that they can effectively be supplemented to improve the outcome of the surgery and to reduce the potential risk for infection and other complications. Not discontinue everything because we don't know anything about it. Why do they want you to discontinue supplements? They're worried about bleeding. And certain supplements will cause kind of a thinning effect on the blood. Predominantly things like ginkgo. I don't know if you've ever taken ginkgo biloba. Vitamin E has a thinning-like effect. Some try to say that omega-3 can have, but it doesn't really. Omega-3 really doesn't thin the blood in the way that would cause a surgical complication. But the advice is still to discontinue all supplements. And so if you're going into that surgery with a zinc deficiency, as I showed you before, skin fragility, reduction of bone healing, increased risk for infectious complications, it's just bad advice. And I would highly recommend that you have a conversation with your surgeon, with your doctor, if you've got a pre-scheduled surgery, because nutrition is going to make or break the difference in whether you have a good recovery or not. Now we also have effects of dietary glucose and fructose on copper, iron, and zinc metabolism in humans. So our results suggest sugar consumption affects copper and zinc metabolism parameters within 2 weeks. Alterations in transition metal metabolism in turn can contribute to aberrant fuel utilization and worsen metabolically related diseases. Now, how many of you going into, if we're talking about surgery, how many of you also have like a blood sugar problem or have been diagnosed with metabolic disease, like metabolic syndrome, high blood sugar, high blood pressure, etc., and your diet's rich in sugar, right? And now you're pushing out your zinc and altering your zinc and copper metabolism, which can exacerbate the blood sugar problems. So our findings are the first evidence that consumption of sugar-sweetened beverage can alter clinical parameters of transition metal metabolism in healthy subjects. So this is done in healthy people. This is not even done in sick people, but this is just giving healthy people sugary beverages and watching their zinc metabolism and copper metabolism tank. The average American, the average person living in an industrialized country isn't healthy. I mean, we could argue that they're not healthy. They have prediabetes. I mean, you look at America itself, it's like 70+% of the population is overweight with some level of metabolic syndrome. You take that, and then you take what we just said about surgery. So in the hospital, this happened recently when I was advocating for someone in the hospital. What did they bring? They were feeding this product right here. Go look up this product if you'd like at the grocery store, but this is a protein supplement product. This was after a surgery. Number one ingredient, sugar. It's a terrible product. It shouldn't be allowed in hospitals. It should be classified as a human poison, and it should be banned from sale in the U.S. But this is what hospitals are feeding post-surgical patients. So you take what I just said about zinc, and that zinc deficiency can contribute to failure for surgical recovery to occur, and then you're going to take a product like this loaded with sugar and feed it to a person who's just had surgery and potentially wreck their capacity to heal and repair from the surgery. Hospitals should pay much more close attention to the nutrition that they're serving up. Okay, let's go to how is zinc absorbed. So the first thing, we said this a moment ago, it requires stomach acid. So in the stomach itself, the stomach parietal cells produce acid. This in turn helps free the zinc up from the protein source that's being consumed. And then it's absorbed down lower in the duodenum and the jejunum areas of the small intestine. So zinc absorption happens in those areas. Now, there are some things that can impact either zinc absorption, or they can also impact how zinc works in the body, and that's largely medications, right? Medications that interfere. And one of them, as I mentioned earlier, the antibiotics interfere with zinc absorption. I'm sorry, antacids interfere with zinc absorption because the primary premise of them is they block acid. We also, so this happens as a blockage of absorption. It interferes with the absorption of zinc from the food that you consume. But we also know that diuretics, ACE inhibitors, and ARBs, these are all blood pressure medications, can deplete zinc. Some of them reduce our ability to absorb zinc. Some of them reduce the ability for zinc uptake into cells. Some of them cause excessive zinc loss through the urine, like diuretics, cause a depletion of zinc through the kidneys. We know that estrogen-based medicines, so women that are taking hormone replacement therapies, HRTs, young ladies that are taking estrogen for their cycles, or they're taking it as a birth control method, these estrogen-based medications can interfere with zinc metabolism. We know this about estrogen specifically, but think also about all the things that mimic estrogen, like certain chemicals, pesticides, plastics. A lot of this stuff is found in cosmetics, ladies. So you're being over bombarded with estrogen-based mimicking chemicals, and this is going to have a major effect on zinc. And zinc plays, again, such a huge role in so many different functions, as we've been talking about. We also know that steroids deplete zinc. So if you've been injected with a steroid, or you take a corticosteroid, specifically corticosteroids are the ones that deplete zinc, among other nutrients. And we know antibiotics can also deplete zinc as well. So if you're on any of these medications for any great length of time, what's the theme of the day? Measure your zinc. It's easy to do. Draw the blood. Look, I'm not a fan of serum testing, but this is something your insurance will cover. Measure your zinc, your serum levels, and ideally, you know, the range is 60 to 120. If we're erring on the side of caution, push for 80 or higher. If you're doing these kinds of things, you need to be prophylactic with, you know, if you're going to take these things, which, you know, my fundamental question mark with any medication is, why do you need a drug for the rest of your life? If the doctor doesn't know why you're sick, how does he know that a drug for the rest of your life is the solution? And the fact of the matter is they don't. So they're just trusting that the medicine is going to do its job, but these things don't come without consequence. In this case, zinc deficiency and the side effects of zinc deficiency that can potentially come with it. Okay, let's talk about some other diseases linked to zinc deficiency. We've kind of talked about some of these things already, so some of this is going to be a little bit of overlap, but a lot of it's new. So one of the diseases linked to zinc deficiency is acne. A lot of disease of the skin, but acne is one of those that we see very common. Now, a lot of people are put on this drug called Accutane when they have acne. Accutane is a synthetic vitamin A, and actually is responsible for thousands of deaths a year. It's, in my opinion, a very dangerous medication. But Accutane, what did we say earlier about zinc? We said zinc produces retinol binding protein, which carries vitamin A through the blood to where it needs to go. And so this is one of the reasons why zinc deficiency is linked to acne, because it's responsible for helping vitamin A make it to the skin, and vitamin A deficiency is a contributing factor as well. That's why they use synthetic vitamin A to treat it. But you can use higher doses of vitamin A naturally. I think a lot of people are deficient in vitamin A in the U.S. Specifically, and in the U.K. and in the European Union, because organ meat is no longer a major food group, and so low-fat diets are so popular. So vitamin A is a fat, and you don't get vitamin A in rich quantities from a low-fat diet and a low-animal diet. Most of the vitamin A is in our animal meats. Don't confuse vitamin A with carotenoids or keratin. Beta-carotene is pre-vitamin A or pro-vitamin A. It's not the same thing. Your gut has to take carotenoids and turn them into vitamin A, and that's not done at a highly efficient rate. So you actually need vitamin A, not just pro-vitamin A, and that comes from animal fat and organ meat. which most people are avoiding because they've been told it's unhealthy for them. So we have, an epidemic of acne that's being treated with a synthetic vitamin A when you can just change your diet, right? And we are all told to eat a bunch of cereal because it's, nutritious and great for you, but it depletes your zinc and causes vitamin A deficiency and leads to acne anyway. Hopefully you make that connection. We also see eczema and dermatitis. As I showed you earlier, those are also illnesses associated with zinc deficiency. Night blindness, as we mentioned, that has to do with the vitamin A. Increased risk of infections and death, diarrhea, depression, failure to thrive in children if you're not growing, infertility in both men and women, bone loss, chronic soft tissue injury with slow healing. There's, in this regard, there's a particular lab test. So you can do serum zinc testing, but there's another lab test called ALP. That stands for alkaline phosphatase. It's not a great marker for zinc, but it comes with a regular chemistry blood test. And sometimes you get lucky and you pick it up. But if your ALP is low, if you have a low ALP, this could mean your zinc is low. And so keep that in mind too. If you ever get a blood test that comes back and your alkaline phosphatase or ALP is low, and your doctor says, oh, there's nothing wrong, that's normal. I get this all the time. People bring me in their ALP result, it'll be low, and their doctor told them, oh, it's not a problem, no, don't worry about it. And then we go on to test them more extensively, and they have zinc deficiencies. So, if that ever happened to you, ask your doctor to measure your zinc too. And then down here we got chronic soft tissue injury with slow healing. So if you've got one of those sprain strain injuries, it's just not healing, you've been out for months and months and it's just not recovering, you need to suspect zinc as a potential possibility for being problematic here. Okay, let's talk about some of the research around some of these things. So if you see here, basics in clinical nutrition on zinc. Deficiency of zinc is well characterized. Reduced growth in children is an early sign. So if you're going to the pediatrician and the growth curve is off, think zinc. Severe zinc deficiency gives the rise to hair loss or alopecia, diarrhea. So babies with diarrhea, as we mentioned earlier, delayed sexual maturation, eczematic skin rash, especially on the face and in the body flexures, that's like the elbows behind the knees, and in the butt folds, and an impaired appetite. So if your child is never hungry, pushing food away and lethargic, think zinc. There are also important effects on immune function. So, we've talked about several of those things, but I think it all bears repeating. Here's another study on the metabolomics analysis. So you can see here, it's a study of 2,550 autistic children. We demonstrated that many of them are suffering from zinc and magnesium deficiency. Furthermore, it's notable that many of the highly burdened heavy metals detected in the autistic children have close relationships with the deficiency of the restricted essential elements zinc and magnesium, and these findings suggest that supplementation of these deficient nutrients is helpful for intervention therapies. There's a correlation between toxic metal and zinc deficiency. So mercury, lead, cadmium, arsenic, aluminum can all, there's a duality relationship between these metals and zinc, and one is that if your zinc is low, so if you have low zinc, then you are more susceptible to toxicity if you're being exposed to these. So it's not just that the metal's causing a toxicity, it's that zinc itself helps to defend you from metal toxicity. So if you're zinc depleted, you're more susceptible to developing toxicity. And this is what we see a lot in the autistic community, is that they do have metal toxicities, but why? Well, because as babies they're being fed these low protein, high cereal diets. A lot of the baby food has been contaminated. We find lead. If you look at a lot of the research that's been done over the past 5 years or so, a lot of the baby food products, including the baby vegetables, the baby fruits, the mashed up things, are lead contaminated. We find a lot. We've had a lot of recalls. We've had recalls of formula. We've had recalls of rice-based cereal that were contaminated with cadmium and arsenic and lead. And so here these babies are being exposed to these, these cereals that already deplete zinc, and then there's metals in the cereal, and so it's no wonder we're seeing, in part, an increase in some of these problems. I know it's multifactorial. This isn't the only situation that arises in autistic spectrum problems, but it's something that certainly we want to think about. And so low zinc increases the risk of metal toxicity because zinc has protective effects on metal toxicity. And then, of course, heavy metal exposures can also deplete zinc. So there's a dichotomy going back and forth here that you want to be aware of. Okay. We have then more diseases. As a result, so mild deficiency of zinc, we get, I showed you this earlier, low serum testosterone, oligospermia. We get thymulin, decreased thymulin activity, which is part of your immune system's maturation process. We get loss of taste, hyperammonemia are all potentials there. And then going on, we get growth retardation, male hypogonadism, rough skin, poor appetite, mental lethargy, delayed wound healing, cell-mediated immune dysfunctions, abnormal neurosensory changes. It's now apparent that a nutritional deficiency of zinc in humans is fairly prevalent. So this isn't an uncommon thing, folks. This is a prevalent, serious problem. I'm going to reiterate again, especially or particularly where cereal proteins are primary in the local diets. So mention that one. Let's talk next about this testosterone thing. So we've talked about this a few times, but correlation between serum zinc and testosterone. This is a systematic review of multiple studies. In this case, it was 38 papers were reviewed, including 8 clinical and 30 animal studies. So 8 clinical human and 30 animal studies were included in this review. We concluded that zinc deficiency reduces testosterone levels and zinc supplementation improves testosterone levels. I've seen cases where men's testosterone increased 300-400 points by correcting zinc deficiency. I mean, half the male population over 40 is running to the doctor to get, hormone replacement therapy. Check the damn zinc already. It's not that hard. Okay, I think this is also pretty profound considering the quantity of people in this country that are overweight or obese. This is another review study. It's a meta-analysis of randomized controlled trials. These are human trials, so this is human data. You see the results. Analysis of 12 eligible randomized clinical trials involving 651 obese, overweight participants demonstrated that zinc supplementation improves fasting glucose, FGE, that's fasting glucose. Conclusion, our meta-analysis indicated that zinc supplementation benefits blood sugar control in overweight and obese populations with an especially significant reduction in fasting glucose. So you trying to lower your blood sugar? How many of you were on Ozempic? How many of you are taking metformin? How many of you are taking some array of diabetic medications? And how many of you have ever had your doctor measure your zinc levels and say, hey, you know what? Your blood sugar's high, your zinc is low. Let's get you on some zinc. No. What do? They jump right to the chemical interventions, the profit of the chemical interventions. And they put you on that stuff for the rest of your life without any mention that you might be low in an essential nutrient, and that's why possibly your levels are too high. Remember what I said earlier? Let me reframe that. Zinc plays a role in your pancreas. You have what are called beta cells. This is where insulin is produced. And inside these beta cells, you have zinc proteins that help to store, produce, and excrete insulin. When we look at insulin as a whole, zinc plays a central role. Zinc is like the centerpiece of insulin. And then when we look at a cell, generally a cell contains these insulin receptors. So what happens? You have zinc in this storage, production, excretion, so it's pushing the insulin out into the bloodstream. That insulin finds its way to the insulin receptors on your muscle cells and other cells that require insulin to get glucose metabolized. And one of the things that happens inside the cells is insulin sends a message into the cell to translocate this special door. It's called a GLUT4 door, GLUT4. This is a door special for glucose. So glucose, once that door is open, glucose can come out of the bloodstream and come into the cell. And this is where then it goes and it's metabolized into energy, or ATP. But this door opening is enhanced also as a result of zinc. So not only does zinc play a role in the storage, production, and excretion of insulin to get to the receptor, but zinc inside the cell helps this door work so that sugar can escape your blood, come into your cell, and make energy. And so when you have such a, we'll call this a pandemic, when you have a pandemic of diabetes and obesity and insulin resistance across the general globe, and you're not even measuring zinc as a potential, and as a doctor, shame on you as the doctor for not doing it, because zinc plays a crucial role in so many different layers of these functions. Okay, let's talk about zinc as an agent for helping fight viruses. So you see here in this particular study the mechanism of zinc action as a potent antiviral agent. We know that with zinc treatment, you get a protective effect against excessive inflammation and oxidative stress. It's this inflammation and stress that causes, the authors misspelled here, that should be a CY, cytokine storm, that causes the famous cytokine storm, and it's that cytokine storm that causes the severe acute respiratory distress syndrome and lung failure. So we know that zinc regulates this, and so it can reduce cytokine storm formation. We know that zinc's role in protein formation helps to stop or prevent viral replication. There's several ways that zinc blocks viral replication, so it reduces the viral load. We also know that zinc treatment can help in regulating natural killer and T-cell immunity functions, so those are helpful in killing the virus. Where that zinc can help in the proper production of interferons. Again, we're talking about viral killing. And we know that zinc plays a role in viral barrier and clearance. So look at all these mechanisms that you have with zinc in an upper respiratory infection, in a viral infection. Again, we were being censored for talking about this stuff before, but I mean, this is not new information, folks. This has been around for decades. We've known zinc is a powerful antiviral for many, many years. Here's another study on zinc in viral infections, zinc and respiratory viral infections. You can see RSV, syncytial virus. And so you've got zinc playing a role. It inhibits the effects of RSV, an enhancement of RSV phagocytosis, meaning it helps your immune system chew up and eat and spit out RSV. It enhances interferon alpha production by leukocytes, helping to neutralize RSV. For influenza or the flu, it decreases viral titers. It inhibits RNA-dependent RNA polymerase activity. Zinc finger proteins can attenuate HA production. Zinc finger protein can attenuate NA production. And zinc finger protein can increase interferon beta. These are all mechanisms to stop viruses from being effective. And in SARS-CoV-2 infection, it's attenuation of RNA synthesis of the virus itself, enhance the effectiveness of hydroxychloroquine and azithromycin in COVID-19 patients, and is reported by many studies. And then ZAP, a zinc finger protein, may restrict the SARS virus by targeting dinucleotides. Low levels of zinc may be associated with increased risk of respiratory complications. So it's not, I mean, I only pulled 2 studies. I could have pulled hundreds of studies, probably thousands of studies on zinc and viruses and viral replication and the power of zinc in the immune system. Okay, let's talk about food sources rich in zinc. How are we going to get this stuff in our bodies? So if you look here, I've given you kind of a list of some of the best, highest let's just say bioavailable forms of zinc. I think it's important because there are foods that are, I mean, like cereals have zinc in them, but they don't have high bioavailability. So these are rich in zinc with great bioavailability, meaning the body can get to the zinc and absorb the zinc and get it where it needs to go. Oysters, number one. Beef and other animal meats. And this also includes organ as well. Pumpkin seeds, if you're on a plant-based diet, you're trying to get more zinc. Pumpkin seeds are a really great source of zinc. Bone meal and bone broth. Eggs, avocados, cruciferous vegetables, spinach, beets, okra, parsley, carrots, although some of these, especially like spinach, has got a high quantity of oxalates that can inhibit zinc absorption. So again, not as bioavailable, but I'm trying to give you some plant-based options as well. Nuts have decent zinc, but many nuts are rich in phytates. If you soak them, you can reduce some of that. If you soak and sprout them, you can get better bioavailability out of the zinc from the nuts that you eat. So there are options there as it relates to enhancing the bioavailability. And if you look at traditional food preparation methodologies, you know, we see a lot of our older cultures would soak and sprout certain grains and seeds and nuts as a result to enhance the digestibility of those foods. We don't do that anymore. And so if you're using those foods but not using the preparation methods, your bioavailability of zinc is going to be reduced. Now here's the RDA. I wanted to show you just kind of this is what the recommended daily allowance of zinc is. This is National Institute of Health, you know, if you want to trust them, the Office of Dietary Supplements. But you can see RDAs for zinc from birth to 6 months is 2 milligrams a day, whether you're male or female. In 7 to 12 months, we go to 3. All the way up to 4 to 8 years, it's 5, and then we get to 9, and it magically becomes 8 milligrams. And 14 to 18, it's 11 for males and 9 for females. 19 plus, it stays at 11, and it stays at 8. A couple of exceptions over here with pregnancy and lactation. In my opinion, these are underestimations of what humans need. The dietary RDAs are not based on health. The RDAs are based on avoiding overt, obvious disease. When we talk about, okay, how does a disease develop? Do you wake up one day and you're absolutely zinc deficient and you have severe dermatitis all over your body? No, that's not how disease develops. It's a slow trickle. You're low enough, long enough, over a long enough period of time. And men, you know, how could it affect you? It may just be lowering your testosterone and your muscle mass or your ability to perform in the gym or in the bedroom. Women, it may be affecting your skin and you may have acne, but because doctors never measure it, nobody ever really has a good understanding of how symptoms can manifest early, because those symptoms that are being diagnosed as other problems and being treated with drugs instead of being asked, the question being asked, is zinc causing these problems? So the RDAs are based on avoiding overt, obvious disease, but they're not based on optimization. Now, you'll see here, there's also something called the UL, the upper limit. It's the established upper limit intake, meaning this is the amount a person could take, you know, it's age-based, where there's no obvious threat to your health and there's no significant risk for toxicity. So you could see this is almost 4 times higher, you know, 40 milligrams, and, you know, for women it is 4 times higher, for men not quite, almost, than the RDA. So why even establish an upper limit if the RDA is so accurate? And that's my point. We therapeutically will use anywhere from 50 to 150 and sometimes higher, depending, milligrams a day. Again, if you're going to do this, work with a doctor, but 50 to 150 milligrams is kind of where we're trying to get into a therapeutic range, you know, correcting deficiency and helping people. But again, 40 milligrams, 34, 23, 12, and 7 for the different age groups is the upper limit intake, meaning you can go that high in those age groups with no fear or risk of toxicity. So keep that in mind. Now, there's many of you are, you know, wondering what about supplementation? What are some forms of supplementation that can be used. Well, these are some of the more common ones. This is not by any stretch a comprehensive list of every form of zinc. I mean, you can find zinc oxide, which I do not recommend. It's not very well absorbed. It's really a cheap form of zinc that crappy supplement producers put in their products because they're taking advantage of people's ignorance, and so they'll use this to save money and increase their markups, but the quality of its absorption is very poor. If we're talking about really good absorption of zinc, probably picolinate is one of the best. Zinc glycinate is also a good chelate. Citrate's a good chelate. Monomethionine is a good chelate. These are all really good forms. And some of the research shows that, like, if you're using, for example, zinc lozenges, this kind works better as it relates to, because there's some evidence now showing that, like, if you have an upper respiratory sinus type of a problem, swallowing zinc is not as effective as a lozenge, meaning the lozenge is, as you suck on that zinc and it stays in your mouth, it's going to start having access through your buccal mucosa to make it up into your sinus cavities to help to get to the location where it needs to be. And so there's some studies that show that if you're using a lozenge, glycinate's a better form, and that you know, anywhere from 15 to 75 milligrams can be helpful at supporting you through that cold or flu or upper respiratory issue. Picolinate is my favorite. I've used this for several decades clinically speaking, and it's very, very good absorption. If you look at some of the evidence as to why, this is one of my favorite papers by Timothy Birdsall. This was published in Alternative Medicine Review. It's quite old, but it's still very relevant. And that you can see zinc picolinate appears to have the greatest efficacy in reversing zinc deficiency of AE. This is the genetic defect that we were talking about earlier, and is also absorbed to a higher degree in normal subjects than other zinc supplements. Unlike supplementation with many other mineral chelates, use of exogenous zinc picolinate may actually provide the compound normally created by the body in the intestinal tract to facilitate absorption. And that's what we want. That's this right here. The body naturally makes picolinic acid, and so taking zinc picolinate kind of helps if your body's struggling there, because to get to picolinic acid, one of the things you need is vitamin B6. If you don't have adequate, you can see up here too, tryptophan, and so where do these come from, right? B6 and tryptophan, if we're looking at food sources of both of these two nutrients that are required to make this chemical that helps you absorb zinc more efficiently, these come from meats. That's predominantly where they come from. Zinc also predominantly comes from meat if we're talking about the diet itself. But you need tryptophan to a certain extent. You need vitamin B6 to get to this chemical. So this is one of the reasons why when I formulate, I like to know the biochemistry of these things. I like to use zinc, and I like to put B6 in it. So you got zinc picolinate plus B6 to facilitate the natural production of picolinic acid so that you can get an improved absorption rate. So, that's not to say you can't use citrate. It's not to say you can't use monomethionine or other forms of zinc, but again, research and my clinical experience, those are my favorite forms. So that being said, shop it at your own risk. What I don't recommend that you do if you're looking for good supplementation is I don't recommend that you buy products made by major corporate conglomerates, and I'm not going to say any names here, but a lot of the stuff that you go over to Walgreens or CVS to buy, one of the biggest problems in their supplement lines is they're full of fillers that aren't necessary. Some of these fillers are binding agents, and they can bind. I've seen zinc supplements from some companies that contain metal binders as fillers. And it's like, why would you use that in a supplement? It's going to reduce the ability to absorb the supplement. So when you're buying cheap, inferior products that put binders, fillers, dyes, colorant agents, petrochemicals as filler, Like, you're not taking the zinc to get all those chemicals, you just need zinc, right? So try to keep it simple. Keep it natural, keep it simple. That's better for you without all the fillers. Okay, let's talk about potential side effects. If you are supplementing with zinc, you can see here, while it's extremely beneficial, too much of this nutrient, and so what's too much? This has been a number that's been researched pretty well. 255 milligrams per day can be detrimental. So if you're pushing over 255 a day, don't. It's not smart. Like I said, upper limit, even in my own practice, I generally keep people less than this, 150 milligrams per day. And if I'm here, I'm really tightly monitoring the level, because I don't want to create a problem by trying to solve a problem either. You see, this toxicity can be expressed through abdominal pain. This is the most common symptom, is I took zinc and it upset my stomach, nausea. And you get way too high, you get some vomiting, and you can get diarrhea as well. And remember, zinc deficiency causes diarrhea, and zinc toxicity can also cause diarrhea. It can also cause nausea if taken on an empty stomach. So it's important that when you're taking zinc as a supplement, you want to take it with food. It's also important that that if you take it with food, but it's a small amount of food and you get nauseous, take it with more food. And if 25 milligrams, let's say you started out with 25 and you took it with food and with enough food, and it made you nauseous, then back down. Start with 10 or start with 15. Everybody's different in this regard. I've seen cases where, you know, people can tolerate 150 for a while, and then as their levels start to correct, that 150 starts making them nauseous, and we got to back them down. So, you know, pay attention to how you feel. Pay attention to any potential for side effect, but these are the most common ones. I mean, there's no reported cases of death by zinc. So, and I'm talking about supplemental zinc or food-based zinc. I'm not talking about breathing zinc fumes or zinc dust because you're being exposed industrially to massive quantities of zinc. I'm talking about, you know, generalized supplementation or food-based. There's no reports of any major complications that aren't very easily reversible by discontinuing the supplementation of it. So, again, these are the potential side effects. Now, if we're going to test for zinc, you know, I've mentioned that serum can be used, and this is, you know, your insurance covers this if you want to use it, but reference range is 60 to 120, and that's micrograms per deciliter. If it's super high, if you're in the 300 range, you're taking too much zinc. If you're down here, in my experience, really, I like to, if I'm looking at it, I like to look at 80 as my threshold there, especially if somebody's got major symptoms of zinc deficiency, because serum is a poor assessment of zinc status, in my opinion, and many others. It's hard to measure zinc. You know, 60% or more of zinc in your body is stored in muscle. So if I'm trying to measure somebody's zinc, and I'm measuring it here, I'm not measuring it in the cell of the muscle. I'm measuring it here in the serum. I'm measuring what's being delivered. It's like looking at the traffic during traffic hour, during rush hour, and then making the assumption that there's lots of cars on the road, therefore we don't have a car deficiency, but I'm only looking at it at a particular time. And you have to understand that the liver and other tissues store zinc, muscle particularly, and so what can happen when tissues start to become deficient in zinc, the body has this really intelligent system to redistribute nutrients from stored tissues to the blood. So redistribution from stored tissue, or storage, if you will, to the blood. And if we're measuring serum, we're picking up potentially on redistribution. And that doesn't mean you have adequate amounts. That means you're redistributing. You're basically robbing Peter to pay Paul to try to get zinc where it's needed absolutely before something fails. So it can be helpful, and I'm not going to say throw the baby out with the bathwater. If this is all you have, get measured. It's better than no data at all. But it's just not going to be the best way to go about looking at it. Better ways, in my opinion, to look at it, You can look at it in the red blood cell. You can also look at something called INA. Red blood cells shows quantitatively how much is inside the cell, so it's an form of intracellular measurement. So it's inside, how much zinc is inside the cell, which a lot of zinc's functions are intracellular functions. But I like INA even better, and here's why. This is a measurement. This is a measuring. It's a quantitative measurement, as is the serum. What do I mean by that? It's measuring quantity in a location, just like this is measuring quantity in a location. Whereas INA is not measuring quantity. INA is measuring outcome of function. So if we can take your cells and measure how well they can perform and grow as an outcome of the measurement, we can actually, we're measuring a functionality. It's a function-based test instead of a bell curve test that is, you know, when we develop these reference ranges, when doctors and scientists develop these reference ranges for different labs, what are they doing? They're taking a large sample of the general population who they think are healthy, although I would argue, how do we know what health is and how do you define health? And so that's flawed in and of itself. So when you take 10,000 people who you think are healthy and you average the level of a nutrient found in their blood, in their in their serum, and then you calculate an average, right? That's called a mean. It's an average or the mean, and then you draw a bell curve around the mean. And the bell curve, you know, if this is the mean here, I don't know if you guys know what a bell curve is, but this might kind of be TMI for some of you, but a bell curve is how they develop lab reference ranges. And so they average it, and then they calculate what are called standard deviations. And so 2 standard deviations above or below the center is considered the reference range. So from here to here. And anything outside of that is considered abnormal. So they're comparing you to other people who aren't you. And that's, I think, one of the fundamental mistakes in lab technology is when you're using tests that have lab reference ranges based on bell curve analyses, you're basically taking a person who's a unique individual biochemical asset that is, no one else in the world is like you. And you're saying, we're going to take this medium and we're going to compare you to these people who aren't you. But also fundamentally the flaw is your serum, the level's going to fluctuate based on last meal and other factors. Let's just say you ate a steak dinner for dinner last night. You go in the next morning, get your serum zinc levels measured, and you absorb a pretty decent amount of zinc from that steak, and then we're measuring what's in your serum that next morning, and maybe it gives you a 5 to 10 point bump and puts you into the normal range, whereas if you hadn't eaten that the night before, it would be lower. This is a reflection of quick moments in time snapshots. It's not a reflection of long-term averages, whereas, you know, red blood cell, with this one, even though it's a bell curve, you still get a 3 to 4 month kind of general average. And INA is even better because this is based on white blood cells, lymphocytes, and so you get a 6 month average, but instead of an average level over time, you get a 6 month functionality outcome. So you're actually measuring how well a person's cells work based on the quantity of storage of a nutrient. It's just a far more accurate way to assess it. So there you have it. You could go about any one of these ways. I'm of the opinion that some data is better than no data, but don't put all your cards in the basket of measuring your serum. If you have all the symptoms of zinc deficiency, if you have zinc-related illnesses, your serum levels, you know, look relatively normal, you could still have a deficiency. So that test can be misleading, and that's why it's important to go deeper sometimes than just that serum test. But if it's all you have available, still better than nothing at all. So there you have it, crash course on zinc. If you found this class helpful, do me a favor, share it with somebody you know. How do we spread the word about great nutrition and great health? We share. And our mission here is to save 100 million lives, so help me do that. It's hard to do with censorship, so you are empowered to do that. So if you walked away with value today, hit like, hit love, subscribe, share, And come back next week. We're here every week on Tuesday at 6 p.m. Central Standard Time for crash courses on nutrition and health. And hope to see you back here then. Take care. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this. And make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.